Hey everyone, Dr. Asad Saleem here, ready to tackle another important topic in the world of autoimmune diseases. Today, let's break down mixed connective tissue disease, or MCTD. We'll explore what makes it unique and how it affects the body. This condition can be quite challenging to understand, even for medical professionals, so let's simplify it together. MCTD is a rare autoimmune disorder, meaning the body's defense system, which is supposed to protect you from infections and diseases, mistakenly starts attacking its own healthy tissues. Where the immune system attacks the body's own connective tissues, the very framework that holds everything together. Think of it as the body's support network for organs, providing structure and elasticity. It's like the mortar that holds bricks together in a building, skin and blood vessels. These are all crucial components that rely on healthy connective tissue to function properly. What makes MCTD unique is its mixed nature. It doesn't fit neatly into one diagnostic box. It combines features of lupus, an autoimmune disease that can affect many different body systems, scleroderma, which primarily affects the skin, but can also impact internal organs by causing thickening and scarring, and polymyositis, an inflammatory condition that leads to muscle weakness and pain. Imagine symptoms from 3 different diseases blending into one, creating a complex and often confusing clinical picture. Patients might experience joint pain like lupus, making everyday tasks difficult and uncomfortable, skin thickening like scleroderma, which can restrict movement and affect appearance, and muscle weakness like polymyositis, all at once, significantly impacting their quality of life. These symptoms can change over time, sometimes improving, sometimes worsening, making diagnosis and management a moving target. It requires careful monitoring and adjustments to treatment plans. MCTD is defined by specific autoantibodies in the blood, especially anti-U1RNP, which are antibodies that mistakenly target a specific protein within the body's cells, and a combination of clinical features from at least 2 other connective tissue diseases. This overlap is what distinguishes MCTD from other similar conditions. It's not just a random mix. MCTD has its own diagnostic criteria and clinical course, helping doctors differentiate it from other autoimmune disorders. Recognizing this overlap is key for healthcare professionals, enabling them to provide accurate diagnoses and tailored treatment plans. Understanding MCTD's hybrid presentation is the first step to effective care, allowing for early intervention and management of symptoms. It's a complex syndrome, but with the right approach, including medication, physical therapy, and lifestyle adjustments, patients can be managed well and lead fulfilling lives. Let's dive deeper into what this means for patients, exploring the specific symptoms, diagnostic process, and treatment options available. So, what does MCTD look like in real life? It's a condition with a wide range of potential symptoms, making it a challenge to diagnose. Raynaud's phenomenon is often the first clue and one of the most common early indicators of MCTD. In Raynaud's phenomenon, fingers and toes turn white, then blue, and finally red in response to cold temperatures or periods of emotional stress. This is due to spasms of the blood vessels. Joint pain and swelling, especially in the hands and wrists, are common symptoms that many MCTD patients experience. The joint involvement can mimic rheumatoid arthritis, causing stiffness, tenderness, and reduced range of motion. Muscle weakness, particularly affecting the shoulders and hips, makes everyday tasks like lifting objects or climbing stairs quite tough. Swollen, puffy fingers, sometimes referred to as sausage fingers, are another characteristic sign. Tight, hardened skin, similar to what's seen in scleroderma, are classic, along with lupus-like rashes that may appear on the face or other parts of the body. MCTD is a systemic disease, meaning it can affect multiple organ systems, so fatigue is nearly universal. This fatigue can be persistent and severe, significantly impacting quality of life. Some patients develop shortness of breath or a persistent cough, potentially signaling lung involvement, which requires further investigation and monitoring. Other symptoms can include difficulty swallowing, unexplained fever, and swollen lymph nodes in the neck or other areas. Given the wide variety of potential symptoms, a thorough medical history and physical examination are absolutely essential for proper evaluation. MCTD's diverse and overlapping presentation with other autoimmune conditions is why it's often called a chameleon disease, posing a significant diagnostic challenge for clinicians. Diagnosing MCTD is detective work. There's no single test. We start with a detailed exam, looking for Raynaud's, swollen hands, joint inflammation, and muscle weakness. The key blood marker is high levels of anti-U1-RNP antibodies, plus a positive ANA test. Imaging like chest X-rays or echocardiograms checks for organ involvement. Diagnosis relies on a combination of symptoms and lab results, ruling out other diseases. It's a careful process to ensure the right diagnosis and treatment plan. There's no cure for MCTD, but treatment focuses on controlling symptoms and preventing organ damage. Mild cases may only need NSAIDs for joint pain. More severe cases require corticosteroids and DMARDs like methotrexate or hydroxychloroquine. Organ involvement calls for targeted therapies, vasodilators for lung issues, stronger immunosuppressants for severe inflammation. Regular monitoring is crucial to adjust treatment as symptoms change. Physical and occupational therapy help maintain strength and function. A team approach empowers patients to live better with MCTD. Living with MCTD, or mixed connective tissue disease, requires a proactive approach to your health. It means taking daily precautions to manage symptoms and prevent complications. These precautions are not just about reacting to problems, but about actively maintaining your well-being and quality of life. Protecting yourself against the cold is crucial to prevent Raynaud's phenomenon. Wear gloves even indoors if necessary, dress in layers to trap heat and maintain a stable body temperature, and avoid sudden temperature changes that can trigger Raynaud's or other MCTD symptoms. Sun protection is vital, not just in summer but year-round. Use sunscreen with a high SPF, even on cloudy days. Wear hats with wide brims to shield your face and neck, and avoid peak sun hours, typically between 10 a.m. and 4 p.m., to prevent rashes and flares. Balance activity and rest. Finding the right equilibrium is key to managing fatigue and pain. Gentle exercise like swimming or yoga helps maintain flexibility and strength, but don't overdo it. Listen to your body and pace yourself to avoid triggering flares. Work with a physical therapist to create a safe and effective exercise plan tailored to your specific needs. Regular checkups with your rheumatologist are essential for monitoring disease activity and progression. These appointments allow for careful monitoring and timely adjustments to your treatment plan. Keep a symptom journal to track your flares, pain levels, and any other changes in your condition. This detailed record will help you communicate openly and effectively with your care team. Early detection of complications, such as lung or heart issues, is key to preventing serious health problems. Be proactive. Take charge of your health by actively participating in your treatment decisions. Don't hesitate to report new or worsening symptoms right away to your doctor. Stay engaged in your care. Active participation and open communication makes a real difference in managing MCTD. Managing MCTD is a partnership between patient and doctor, requiring trust and collaboration. With the right precautions, a positive attitude, and a strong support system, patients can lead active, fulfilling lives despite the challenges of MCTD. While there's no special diet for MCTD, nutrition matters. Focus on anti-inflammatory foods, fruits, vegetables, lean proteins, and healthy fats like omega-3s from fish and nuts. Limit processed foods, sugary drinks, and unhealthy fats. Track your diet with a food diary to spot any personal triggers. Long-term steroid use can weaken bones, so get enough calcium and vitamin D from dairy, leafy greens, or supplements. If swallowing is difficult, choose softer foods and eat slowly. Plan simple, nutritious meals to combat fatigue. Food won't cure MCTD, but it can help manage symptoms and boost energy. A balanced diet supports your body's defenses. Nutrition is a key part of comprehensive care. We've covered what MCTD is, its symptoms, diagnosis, treatment, and daily management. Understanding complex diseases like MCTD is essential for providing great care. Stay curious, keep learning, read new research, and follow updates in rheumatology. Share this video to help others understand MCTD. Your knowledge can make a difference for patients and colleagues. Have questions or topics you want covered? Drop them in the comments. Subscribe for more health insights. Thanks for watching. Stay healthy and see you next time.